Today I'm going to be teaching you about sudden infant death syndrome. SIDS is the sudden unexplained death of an infant younger than 1, usually during sleep. The exact cause is unknown, but the leading theory is the triple risk model: vulnerable infant, immature brainstem, or impaired arousal response.
Okay.
Problems detecting carbon dioxide or low oxygen. Critical development period. Highest risk is 2 to 4 months when sleep-wake control is still developing. And then the third one is external stressors: prone sleeping, soft bedding, overheating, exposure to smoke. When all three overlap, the baby may fall or wake to reposition to breathe normally.
Are there any risk factors for that?
Yes. Infant-related risk factors are age 2 to 4 months,
Okay.
preterm or low birth weight, male sex, recent illness.
Interesting.
Maternal and pregnancy factors are maternal smoking, young maternal age, late or no prenatal care, alcohol or illicit drug use during pregnancy, and some environment and sleep factors. These are most modifiable.
Okay.
Is the sleeping on the stomach or the side, bed sharing with adults or siblings, and overheating.
Gotcha. What about signs and symptoms? What are those?
There are no warning signs of SIDS. Infants appear healthy before the event. Because SIDS is only diagnosed after death, prevention is the key focus.
Gotcha.
Some special concerns is that it's a higher risk in low-income families, crowded living spaces, and unsafe sleep environments. And higher incidence in Native American and African American infants. And most people ask if there's increased risk for infants recently vaccinated, and no, their vaccines do not increase the risk for SIDS.
Gotcha. That's interesting to know. What about, how do you determine it? What kind of labs or diagnostics do we need to do?
There's no test to diagnose or predict SIDS happen in an infant, but after death, medical examiners perform a full autopsy, death scene investigation, review of medical history, and this is to rule out any other causes like infection, trauma, or metabolic disorders.
Sure. So what kind of treatment do they do for something like that?
There's no treatment because SIDS occurs suddenly and without signs.
Oh.
Instead, we focus on risk reduction and safe sleep practices.
Excellent. What about diet? Yeah, that's what I was going to ask.
Breastfeeding is protective against SIDS. Exclusive breastfeeding for greater than 2 months significantly lowers risk. Avoid letting the baby fall asleep propped up with a bottle. That's a aspiration hazard.
Right.
And ensure adequate nutrition to support normal growth and development.
Gotcha. Okay.
Some priority education for moms or families with infants is the safe sleep ABCs.
Oh.
A is for alone. Baby sleeps alone in a crib or bassinet, no bed sharing. B is back. Always place baby on their back in the crib.
Okay.
And C is crib. Use a firm mattress, fitted sheet, no pillows, blankets, no toys, because you don't want them to grab them and accidentally.
Okay. I had never heard that. That's
Right.
interesting.
Some additional key information to remember when educating people on SIDS is room share for the first 6 months, but no bed sharing.
Right.
Keep baby sleep area cool, not overheated. Use wearable blankets, sleep sacks instead of loose blankets in the bed. Avoid exposure to smoke, alcohol, and drugs before and after birth.
Okay.
Consider offering a pacifier at naps, bedtime, once breastfeeding is established, and keep immunizations up to date. Teach parents to avoid products marketed as SIDS preventing. They are not proven.
Yeah.
And teach safe tummy time only when awake, and supervise to strengthen the neck and airway muscles to hopefully prevent SIDS.
Oh, very interesting.
So, yeah.
These were things I didn't know about. I really appreciate you telling me.
Yeah, of course. So that is sudden infant death syndrome.
Thank you.